Hi, I'm Edgar Martinez Neri, and this video is aimed at doctors, researchers, and health professionals to whom I want to share a process that my grandfather, Dr. Arturo Neri Calvo, invented several decades ago. This process could contribute to the recovery of people affected by the coronavirus COVID-19 through an improvement in their nasal ventilation. I want to emphasize that I'm not a doctor, and the goal is that health professionals can clinically test, improve, and apply this procedure. My grandfather, Dr. Arturo Neri, was born in 1918 in Guerrero, Mexico, and studied medicine to specialize as an otolaryngologist. He traveled to the United States to continue his specialization in otolaryngology, where he studied with Dr. Lawrence R. Boyce. Thanks to his medical experience, to the knowledge acquired in the United States with Dr. Boyce, and to the study of the book by Drs. Boyce, Hilger, and Priest entitled Fundamentals of Otolaryngology, which I show here, my grandfather developed a method to improve nasal ventilation, which he called local nasopharingeal healing. During the video, I will explain the details of this healing procedure, and I want to share it with the world because my grandfather, Dr. Arturo Neri, passed away in 2007, and he taught me this procedure. I want to point out again that I'm not a doctor, so I will explain literally what my grandfather taught me. My grandfather explained to me that the nose is the organ responsible for cleaning, conditioning, and heating the air that enters the body, and therefore is the basis for the proper function of the respiratory system. During the outbreak of the severe acute respiratory syndrome, or SARS, in 2003, I asked my grandfather if the local nasopharyngeal healing could help to heal the people affected by SARS. He said yes, because the primary function of local nasopharyngeal healing is to improve the quality and amount of air entering our respiratory system. Therefore, while the local nasopharyngeal healing is not a vaccine against a microorganism, this procedure could improve ventilation of the respiratory system and oxygenation so that the body heals faster. As a result, the application of the local nasopharyngeal healing could act as a palliative to decrease the severity of an infection in the respiratory tract. Today, I want to publicly transmit the local nasopharyngeal healing that my grandfather developed. It is 2020, and as humanity, we face the coronavirus, or COVID-19, and I want to make public knowledge of the active substances and application process developed by my grandfather, Dr. Arturo Neri, and which he tested empirically for several decades. I want to ask professional doctors, researchers, and health workers to test and develop the local nasopharyngeal healing, to apply it and reduce the damage caused by COVID-19, and, as far as possible, to save human lives. As I mentioned earlier, all the credit for the development of this procedure corresponds to my grandfather, Dr. Arturo Neri, and to health professionals such as Drs. Boyce, Hilger, Priest, and all those who indirectly participated in its creation. Active substances and materials. Everything is new. All these substances are available over the country in Mexico, but its use depends on the rules of each country. Health professionals who use them know the contraindications, risks, and side reactions of their use. First, we have nafazoline nasal, 1 milligram per milliliter of ISA solution. Then oxymetazoline nasal, 0.050% solution. Then lidocaine at 2%. Then benzalkonium chloride solution at 0.13 grams per 100 milliliters. Sterile applicators with cotton with a length of at least 15 centimeters or the equivalent in inches. Standard applicators. The main component of the local nasopharingeal healing. To warranty the sterility of the substances, I will use surgical gloves and a surgical mask. I will mix in a sterile container lidocaine and oxymetazoline in equal amounts. Oxymetazoline acts as a constrictor vessel of the nasal mucosa and dries the nasal mucosa to improve nasal ventilation, and lidocaine potentiates the action of oxymetazoline. Also, due to the action of lidocaine, the spasm of the bronchi or bronchospasm is blocked. Once I mixed the two active substances, I will begin the process to apply the nasopharyngeal healing to myself. Application of the nasopharyngeal healing. The first step in the procedure is the asepsis of the mouth, which I did by brushing my teeth and using mouthwash. The second step is to wet 2 small applicators in the benzalkonium chloride solution and gently place them in the external ear canal, taking care not to introduce them to the eardrum. My grandfather mentioned that this step is to avoid ear infections. The third step is to make 2 sprays of nafazoline in each nostril. After 10 minutes. After 10 minutes of having performed steps 1, 2, and 3, I'm going to remove the applicators from my ears and deposit them in a container of biological infectious waste. The fourth step is to moisten 2 15 centimeter applicators in the solution composed of lidocaine and oxymetazoline. And I'm going to introduce them one by one into my nasal cavity, exemplifying with the illustrations on pages 54 and 174 of the book by Doctors Boyce, Hilger, and Priest, where I exemplify with a 15 centimeters applicator. It is very important that the applicator be introduced on the basis of the nasal cavity, in the space that goes from the nostrils to the nasopharynx. It is introduced by raising the tip of the nose to give more space. The applicators must be introduced for 1 hour. When the nasal septum is deviated, there will be discomfort when introducing the applicator. So the introduction of the applicator should be smooth and gradual. Therefore, the local nasopharyngeal healing has two fundamental actions. The first one, due to the effect of the active substances, and the second one, due to the mechanical effect of the applicators, because they allow more inflow and outflow of air. My grandfather used local nasopharyngeal healing to cure a series of respiratory conditions through improving nasal ventilation. He explained that this process performs the decongestion of the nasal cavity, the sinuses, and through the eustachian tubes, the airs as well. After half an hour of the first step, my nose secretes nasal mucosa due to my grandfather's explanation about the process of nasal decongestion. At the end of the hour. At the end of the hour, with the 15 centimeter applicators, I will gently remove them and deposit them in the biological infectious waste collector. My grandfather recommended applying the local nasopharyngeal healing on a daily basis until the microorganism disappears. I am going to clean my nose to remove excess mucus, and I am going to breathe. As you can see, I breathe very well. As I mentioned initially, my grandfather explained that by promoting nasal ventilation and oxygen intake, the respiratory system works better and recovers faster. Therefore, this procedure can be used in various respiratory conditions. In this way, I conclude this video, and again, I emphasize that I want to ask professional doctors, researchers, and health workers to test and develop the local nasopharyngeal healing that my grandfather, Dr. Arturo Neri Calvo, made and applied for several decades. I publicly show the local nasopharyngeal healing so that this procedure be applied and reduce the damage caused by the COVID-19 and, as far as possible, to save more human lives.